let me say, and this is maybe an added question, is that the Chinese authorities, my understanding at least is reported in the New York Times, I think Mr. Ma, they're reporting that they think that the disease is communicable during the incubation period, meaning when people are asymptomatic, it can be transmitted. I understand that that hasn't been confirmed. Other agencies like the CDC have questioned whether that's really the case, but I think the foremost authorities on the novel coronavirus are going to be the Chinese. So if they figure it's that way, Britain has already taken action in terms of voluntary coordination. It would seem to me something that maybe we ought to consider. I don't know how drastic that is. I was under quarantine under SARS-2, when I saw someone who supposedly, when SARS was over, someone who turned out to have SARS without any precautions. I put myself in quarantine figuring, I know he's got SARS, and sure enough, he did, but it took about 6 or 7 days for the public health agency to report that to me. But I don't know if that's asking too much, given the possibility to ask people to voluntarily quarantine. And if the British are doing it, I would suggest we ought to think about it.
So I know that the World Health Organization is actively in China looking at the evidence. So that is a very key piece of evidence that we're trying to ascertain. But we do know something about coronaviruses, given that we've had other coronaviruses that cause anything from a mild illness, the sort of common cold, all the way to a more severe end of the spectrum, such as the SARS coronavirus and the MERS, or Middle East Respiratory Syndrome coronavirus. So based on what we know about those coronaviruses, is it possible that an asymptomatic person could transmit the virus? Even if it's possible, it is, we believe, a rare event. And it is not that type of transmission that drives the force of an epidemic. So I think we have to be reasonable in our public measures and just balance out the risks and benefits in terms of the impacts that are not simply health, but psychological, other health impacts, as well as non-health impacts, being societal and economic as well. So I think it is not something that it's something that we're pursuing very actively with the World Health Organization, and they know they have to get to the bottom of this. But we do know that even people with mild symptoms don't transmit very readily. Could they? Possibly. But that's not what drives an actual epidemic.